training, I'm a surgical oncologist, a head and neck surgeon, but cancer control, cancer prevention, cancer equity has always been dear to my heart. And that's one of the reasons I kind of joined the UICC, because it gives you an opportunity to do that. And I'll share my thoughts, and I was asked to share my thoughts as a UICC president. So it'll be a little more global, while Partha, I know, will cover the more national stage. I am as well humbled to be part of great pioneers in cervical cancer, Nirja, Surendra Shastri, Anita Borges, and Partha, all of whom I know very, very well. So quickly, a recap of the UICC, the largest NGO established in 1933, committed to the cause of cancer control. It's basically the largest voice, and this is one of our flagship programs now, and I'll go along as I tell you. So basically, the UICC is a member organization. We are touching 1,200 members across 172 countries with a mission to unite and support the cancer community, to reduce the global burden, to promote greater equity, and to ensure that cancer control continues to be on the World Health and Developmental agenda. And the work of the UICC is basically into three large buckets: convening, capacity building, and advocacy. Let me go into the slide view. Yeah. So it's convening, capacity building, and advocacy. Advocacy as in tobacco control, cervical cancer vaccination. Capacity building is new initiatives to strengthen the cancer community. And convening is some of the best meetings that we have: the World Cancer Leaders Summit and the World Cancer Congress, two of the biggest events held by the UICC. COVID has taken a big impact, and it's a wrong, I don't know if it's a wrong time or a challenging time for me to take over as president of the UICC. We did a survey across our members, and as you can see, more than 75% of our members had a significant drop in their financial statements. 3% will cease to operate as a result of the pandemic. 40% have seen a drop in income between 25 to 75%. 20% have seen a drop up to 25%. And it's really taken its toll on our organizations. But as you can see in our board of director meetings, we have decided to continue to support the WHO in cervical cancer elimination initiative. And that's why I'm here today to share these thoughts with you all. As has been said by the previous two speakers, it's a preventable cancer with gross inequities between countries. Sub-Saharan Africa, parts of Latin America, and our region of Southeast Asia are really the main areas where we have cervical cancer. And again, as has been said, about 600,000 new cases with half the number of mortality every year. And it occurs in places which are coexistent with the HIV infection. And that's particularly in Sub-Saharan Africa. Now we know that cervical cancer goes through various stages. And from the time of infection, we go through the pre-cancer stage and then the cancer stage. Well-defined primary prevention, secondary prevention, and tertiary prevention methods. WHO has all this. They are well-defined global guidelines, global indicators, global cost-effective recommendations. Yet, we continue to blame our women for this high incidence of cervical cancer. And I think it's time that we re-looked at our programs in terms of equity, integration, and quality of care. And I think while we knew we have to control cervical cancer, and this has been known ever since I've been a student, Tedros, Dr. Tedros, the Secretary General of the WHO, or the Director General, was the first to call us to action on the 21st of May, 2018. And this call to eradicate cervical cancer from the face of the earth has been supported by many organizations. And as you can see, the UICC is pivotal in this fight to cervical cancer. We have the tools to prevent, detect, and cure this cancer. And we really need, as in the words of Dr. Tedros, to relegate this cancer to the history books. To support this call, it has to go through the WHO Executive Board. It was supported by 70 members, basically fast-tracked through the EB, the 144th EB. It went back and a revised strategy was then presented again in the 146th Executive Board. And we were supposed to adopt this at the World Health Assembly in May of 2020. But just because of the pandemic, there was a silence procedure initiated for adoption on the 23rd of July. And the World Health Assembly will formally launch this on the 17th of November this month. And UICC is an integral part of this program. Now, what's the global strategy? 90, 70, 90. And that's what's going to make the world free of cervical cancer. The aim is to get 90% of girls vaccinated before the age of 15. 70% of women should be screened by an HPV test between 35 to 45. And data shows that 2 rounds of screening are fine. If you do 1 round of screening, your coverage or decrease would be 50%. 2 rounds is what is recommended. And 90% of women who are diagnosed with pre-invasive or invasive cancer should get treatment. And then we go and hit towards the SDG goals of 2030, 30% reduction in mortality, making the incidence less than 4 cervical cancers per 100,000 women. The focus is on coverage for equitable access and outcomes, leaving no one behind. And I'm aware of the opposition within our country, and Jyotsna briefly alluded to it against the vaccination. There's just one lobby that has seemed to influence people, and I'm sure it will come out in the panel discussions as we go along. To put this 90, 70, 90 into framework, if we just did vaccination, current vaccination and screening, giving the high incidence, this is the projected control rates in a blue line. If we did intensive vaccination, we would see a drop, but it would take us many, many years to achieve eradication of cervical cancer. And really what is required is a combination of vaccination and screening to help us to get to our goals and probably reach them by 2060. It's a big challenge in African countries, but they have stood up and many of them have adapted to it. And I see no reason why we in our country, with a somewhat better public health system than parts of sub-Saharan Africa, cannot do the cervical cancer elimination. Again, putting this in terms of figures, if you look across 78 low middle income countries, you can see that if we started doing this approach, the dual approach of screening and vaccination, there'll be a 34% drop by 2030, 69 by 2045, and slowly as we go out, we'll be seeing this totally eliminated. In terms of numbers, to the panel to your right, 15 million lives will be saved by 2030, 70 million cervical cancers will be averted, and 62 million women deaths will also be averted. Australia seems to be on track to eliminate cervical cancer by 2028, at least in the state of Victoria, and in the next 2-3 years across the entire country. One of the countries that has vaccination for both boys and girls. And in definition for Australian and European countries, a rare cancer is less than 6 per 100,000. And as I told you, we are hitting at less than 4 per 100,000. US are trying to catch up and want to be the first. Canada have put a program in place and they should be there by 2040. I think this next point is very important, that many countries like Zambia, Kenya, Bhutan, Rwanda are all on the cervical cancer. So I think we need to ramp up home, and I'm sure Partha will cover some of this in his talk uh, on the national scenario of cervical cancer eradication. As I said, WHO is going to launch the global strategy on November 17th. There's a lot of data. I've given the link sites. You can Google, you can get it. And we at UICC are strongly supporting this. And again, if you go to the UICC homepage, there are a lot of toolkits that can help you. So I've got 5 minutes. I'll be done within 5. Am I correct? Is that 5?
Yes,
yeah,
thank you.
I'll be done within 5. Okay. Julie Torrey, who used to be the deputy CEO, now heads what we call the director of special projects. And here is her email ID for those of you all who want to have support from within the UICC. She is full-time dedicated from the UICC to support the WHO initiative and help members. And I know ICS is a member, and the UICC has always had a soft spot for India as a country. So we'd be very delighted to support any of the program. I'm now heading there. So I'm sure whatever support UICC can give will come from there. And there are a lot of toolkits. You have cervical cancer elimination toolkits. There are a lot of resources, press release templates, resolution talking points, and you just have to go, and they're all free downloads, resources that we have on the UICC website. We are building momentum, regional advocacy, technical assistance, best practice platforms, various organizations across different regions of the world, ECHO, Francophone, and PAHO at different parts of the world. Just quickly to stimulate people who are policy makers within today's discussion, Brazil have a good program in place. Malaysia have leapfrogged. They've made a lot of changes. And if I can just take a minute, I can take a little time from my last talk, which really is covered in this slide. What is the future? They're looking at women doing self smears, looking at better methods of investigating, that is HPV DNA rather than conventional, and using information technology to prevent again attrition from the classical follow-up. So probably Malaysia is doing something different from the rest of the world. Kenya are supported by the First Lady. Widespread vaccination. Here in the middle panel is a survivor with a daughter, and probably the first girl who got immunized in Kenya. All these efforts are supported by, funded by Unit Aid, and there's a consortium of various organizations with different jobs, and UICC, as you can see, is part of advocacy, civil society mobilization, and scale up. 4 model cities with various activities towards cervical cancer and with different objective endpoints for assessing success of this program. And Jyotna said that evidence is not coming from many places in Delhi, but one of our first outputs is to get good evidence towards support of this cervical cancer elimination. This is my last slide, and it just recaps whatever I've said and what the UICC is doing. So basically strengthen the civil society to advocate and drive national implementation activities, support for the strategy, all of society approach, including the private sector, securing funds for fellowship that support cervical cancer elimination, and keeping the spotlight on elimination through to 2030. So in brief, I've tried to cover the UICC role, and thank you very much once again